Sure. I am Dr. Dimiladi Adedinsho, and I'm a non-invasive cardiologist. I work at Mayo Clinic in Jacksonville, Florida. So yes, my clinical interest really is in women's cardiovascular health as well as in echocardiography, but my research really focuses on the use of artificial intelligence tools for cardiovascular screening during pregnancy and in the postpartum period. Excellent question. So I do believe that there is an unmet need for cardiovascular screening during pregnancy and the postpartum period. A lot of this has to do with challenges because of the overlap between pregnancy symptoms and symptoms that might be suggestive of cardiovascular disease. So for instance, pregnant women might complain of lower extremity swelling or shortness of breath with minimal activity, or even shortness of breath while laying in the bed at night. And some of this could be red flag symptoms for heart failure, but sometimes we see this during pregnancy and it's hard to tell who's high risk or who's at risk for having heart failure during pregnancy. So we're hoping to leverage some novel AI tools that can take data from a non-invasive test like an ECG to predict the likelihood of having heart failure during pregnancy. I should also mention that having heart failure during pregnancy disproportionately affects Black women, and also Black women have a higher mortality during pregnancy and in the postpartum period, 4 times higher than white women. So being able to develop this tool can help us objectively assess pregnant and postpartum women and also narrow the disparity gap when it comes to cardiovascular mortality. So no, not yet. And that's why I mentioned that this is an unmet need, right? We currently do not have any tools to screen for cardiac problems during pregnancy, apart from, having your blood pressure checked during pregnancy. Really, your physician or your obstetrician has to have a high index of suspicion, and then they can recommend you seeing a cardiologist or, getting an ultrasound of your heart done, which is an echocardiogram, and this can be expensive. ECG, on the other hand, is very easy to get. It's readily available. It's, relatively inexpensive. And now with the advent of digital tools and technologies, now you can record an ECG with a smartwatch. We can record ECGs with digital stethoscopes. So we are looking at other avenues to record the ECGs that can be done at a point of care and screen these women without necessarily increasing cost. So I completely agree with you. I do think it's important to listen to the concerns of women, and the CDC actually has a campaign now for pregnant women that says hear her, because sometimes some of the symptoms can be blown off. And the other issue, like I said, is it also overlaps with common symptoms that we see during pregnancy. We actually conducted a pilot study to see how frequently do pregnant women report things like shortness of breath with minimal exertion, and almost 70% of women would report that. So it can be a bit challenging, and that's why putting that pressure on the physician to have a high index of suspicion of who is at risk or not, it's a little bit tricky, which is why we need screening tools so that these women can be screened and then you can identify who's high risk and who's not. Thank you.